There we go. So we'll have the recording to refer back to. But the last 20 minutes to 30 minutes, depending on how quickly I get through the material, I'm going to put up a poll, and I'm going to ask you all to pick some. There's going to be a list of common challenging behavioral expressions, anywhere from agitation to verbal abuse, toileting. There's going to be a list there, and I'm going to ask you to choose which top 2 to 3 would you like to discuss today. So I really want to poll you as the audience today to really dive deeper into those specific common challenging expressions. And then we'll spend some time talking about that. But again, you have the slides, you have all the information on the stuff that we will cover and the things that we will not get to cover today. So you have access to it. And always feel free to email the James O. West Center, whether it's myself, my colleague Holly Glover, or our other education team, if you have questions about anything that we cover today, or maybe we didn't get to cover it and you're having some challenges or you have questions about it. That's what we're part of the reason we are here. So, but just very quickly, the James L. West Center, we have been in operation for years, and we service persons impacted by dementia. And we do that through a variety of services. We do have a long-term care community here in Fort Worth, Texas, that we take people that live here with us from very early stages all the way up to end of life. We also have a senior day program that is what it is. It's a senior day program. So our participants that come during the day, they get the same expert care, programming, socialization during the day, and then they get to go home at night, and their care partners get some rest or respite. And we do have a dementia specialized short-term rehab as well. So if somebody that has dementia needs to go to short-term memory, we have expert specialized therapists that can help those manage that, even though they might be living with dementia. And then, of course, we have our education we're taking advantage of today. And we provide a variety of education every week in support groups. We do have a support group that meets online every Wednesday at 1, which you're invited to attend today. And then we have one that meets in person every Friday at 11:30. We also have a once-a-month support group that meets the second Saturday of every month, and that is specific to grief. So the grief of caregiving, the grief of loss, anticipatory, ambiguous, but then also the loss after death. So for more information, you'll get that information in our follow-up email, but also know that those are open to the public, and we highly encourage everybody to try them out. So today we are going to talk about, like I mentioned, we're going to talk about behavioral expressions, why they occur, understanding maybe the why behind them, and then we'll walk through a tool that helps us identify the what, the why, what am I supposed to do, and kind of some checklists that we can go through to help us decode or help us be a better detective to figure out why my person is expressing themselves in this way. And then that way I can provide better care for them because I can problem solve better. And then again, the second half or 20-ish minutes, we'll talk about, get your polls and talk about specific common challenging expressions. And I hope you've noticed that I'm using the word expressions and not behaviors because, sorry, let me get through this. Behaviors, which is commonly used and has been used for a long, long time in dementia care, has a really negative connotation to it. But behaviors is a form of communication for people that are living with dementia. And hopefully you've heard that by now. If not, I'm glad you're hearing it today. But we're moving away from the term behaviors, which is negative, unfortunately, and more to expressions, because somebody that's having a behavior or they're expressing themselves really is they are trying to tell us something. So people with dementia, things change for people with dementia. We know that, right? We understand the changes that are happening. But what doesn't change for somebody with dementia is their need to communicate. It's their wants, their wishes, their likes, dislikes, desires, their pain, discomfort, excitement. They're always going to communicate that. What's changing is how they are communicating it. And typically what changes is they lose their words and their ability to form a sentence and explain to you why they're acting out in a certain way or why they're responding to a person or the environment in a certain way. But what they're going to do is they're going to start using their expressions or quote unquote behaviors. So the term behaviors shouldn't be negative, but it does have that negative connotation to it. And you and I, we use behaviors and expressions all day long to communicate ourselves. We do. It's just how we act. It's how we respond to situations, people, events, feelings, external things, internal things that are going on. But with dementia, persons with dementia, that's primarily their form of communication. They may not have the words to explain themselves. And we got to think about people with dementia are doing the best they can with what they still have left. Mm-hmm. And the disease is taking away their ability to understand the environment, their ability to use their words to explain themselves or to communicate. But do know that somebody that's expressing themselves in a certain way, there are expressions and there are going to be challenging expressions. We're going to talk about those challenging expressions, but know that somebody with dementia might have some odd expressions, or they might be doing things differently than they used to. And that can be hard for us as their loved ones to see that. But we also have to stop and ask ourselves, is that something where I need to intervene in? Because there will be times where you will need to intervene or step in or manage a more challenging expression, or they're having a difficult time. The other times it might just be odd behavior, or they're doing it differently, or it's a lot slower than they used to, or whatever it may be. And that's when we need to step back as their care partner and say, do I need to let them continue to be as they are doing? Because they're safe, they seem content, they seem happy, they don't seem upset or agitated in any way. I just need to let them do what they're doing and how they're doing, because people with dementia are doing and behaving in normal ways to them. So we have to step back and sometimes kind of check ourselves to see if we need to intervene or not. So there are incidences of challenging expressions, and the studies show that approximately 80% of people with dementia will show at least one challenging behavioral expression. I'm going to say that statistic is low because everybody shows incidences of challenging expressions, whether they have dementia or not, right? And this is just a list with the percentages of what we tend to see, okay? Now, as you look through the slides or you study these later or pull up the poll of different common, there's over 36 common different symptoms of dementia. Your loved one or your person may not experience all of those common symptoms or challenging expressions. They might experience some of them. They might experience one that is not on that list. But please, as you look kind of at the list or the information on the slides, and please don't think, oh gosh, okay, well, when is it going to happen when my loved one starts doing this? Or it's just a matter of time before they start doing X, Y, or Z. Because dementia is a very individualistic disease. So we're talking in general, typical common symptoms and common behavioral expressions. I will point out, though, that most people that have a challenging expression does happen during personal care time. And I can probably understand why, because if let's say I have dementia and somebody's coming in and helping me with that personal care time, whether it's bathing or it's toileting or it's getting dressed, and I don't understand why they're there or I don't understand what they're doing, yeah, I might have some challenging expressions too. Mm-hmm. So that makes sense if we really think about it. Looking at this picture here, this is, you may have seen it before, this is a really good reminder for us to see of what's happening inside the brain of somebody that has dementia. You can see on the left-hand side, that is somebody with a normal brain. So it's 3 pounds. That's your brain. It's my brain. It's a healthy brain. On the right-hand side, this is somebody with very late stage, or they've passed away from Alzheimer's disease or related dementia. So you can see just by looking at the comparison here that there's differences. The one on the right-hand side, it's smaller. There's more holes or more distance between the crevices. You can see the differences and you can see the losses, right? And that when we look at this, I want to ask yourself, can we expect the person with the brain on the right-hand side to behave or react or respond in the same way as the person with the brain on the left-hand side? And looking at this, we can say, no, we can't expect that. But when I see my mom right in front of me, who has been my mom my entire life and been able to do and always done, it's hard for me to not expect her to be able to do like she used to. I do want to step back and say, just because we see there's a lot of losses there, please note in our philosophy of care here at the James L. West Center is that there's still a lot left, even in the very late stages. We want to focus on what's remaining. And we're going to talk about how do we focus on that for the rest of this hour. But know that these changes, they're there, but what do we focus on what's remaining? So we can see with the brain changes that are happening, a person with dementia is having a much harder time understanding their environment. This can be just the stimulation. Maybe it's the temperature, it's the light, there's too many people, but it can also be how we are communicating with them. So it might be how we're saying something, what we're saying, maybe too much, that we're saying too much, and they're having a hard time processing and comprehending the words or instructions or sentences that we're using. And that happens pretty early on, and over time as the disease progresses, it just gets harder and harder. They can be startled by loud noises. There can be just a misunderstanding or misinterpretation of what's being said versus the action that's being done. And the example here is if I'm helping somebody in the shower and I am not using my best communication skills, it can very easily be interpreted as maybe there's some sexual activity about to happen. Because clothes are being taken off, we're trying to be chipper about it, we've got a smile on our face, we're trying to be helpful, and it can be misinterpreted fairly quickly. So just misinterpretations, right? Another thing that can cause unwanted expressions for people with dementia is that they're being treated like a child. And this can look anything from where we are talking to them like a child, we are using words that might be childlike, oh, honey and sweetie, things like that, but also not allowing them to do like they've always done. So we're taking things away from them that maybe they can still do. Like we would with a kid, we might not allow them to do everything so we know they can't do it, if that makes sense. Which also in turn, if we do that, and unintentionally we might do that, they can be left without a feeling of purpose or without a feeling of worthwhile or that they're needed or that they're wanted. And when we have feelings of what's my purpose or I don't feel worthwhile, then that can manifest into a lot of unwanted expressions. There might be a conflict with other people, whether it's another resident or it's another person in the house. And with dementia, so their need to communicate is always going to be there. Their feelings and emotions will always be there. That remains forever. Their humanity remains forever. But what's changing is how in control they are of their emotions, or they don't have impulse control, or they've lost their filter to say or do something inappropriate. So all that stuff's still there. It's just how they're using it is going to be different, or they're not as in control of their emotions or impulses. So some other things that are very common that can increase or might be a cause of unwanted expressions are being in a new environment. And this can be anywhere from they've moved homes, or they moved into a community somewhere, or they're in a very high stimulation environment. The doctor's office, maybe it's the pharmacy, maybe it's your cousin's house where there's a party going on, or it's just a new environment overall. Maybe you've moved everything from your upstairs to your downstairs, so stuff is arranged differently. And there can just take time for it to adjust. It typically takes about 72 hours to adjust to a new room, a new place. If you're moving to a new home or into a community somewhere, we really want to give that about 28 to 30 days for time for them to adjust to their new surroundings. The further they are in their disease state, it might take a little bit longer for them to adjust. But as they're adjusting, there might be more confusion, more increased restlessness, more agitation, things like that. If there's undiagnosed pain, whether it's a headache, a toothache, a blister, you name it, they're going to communicate that pain or that discomfort, usually through an expression or a physical problem. Bored or lonely. I think this is a big one that gets overlooked quite often as well. If they are bored or they are lonely. How much, then this kind of goes back to that having a purpose and feeling worthwhile. What are the activities that they're doing? I mean, are they, because we're as care partners so tired, are we able to give them activities that facilitate purpose and well-being and quality of life? How do we change their old activities like hobbies they used to do and make them appropriate for them to do them now and still be successful, but it's safe? Or if they are in a community somewhere, are the activities being provided very entertainment-like, which is great. I'm not knocking entertainment activities, but are there also purposeful activities mixed in with that to where they are able to contribute back to the community or the household, just like they always have? And then it might be a negative approach from a care partner of any or just any person in their environment that might be communicating impatience, exhaustion, frustration, tiredness, you name it. And so they're getting that negative approach or negative communication unintentionally usually, and they respond in kind. And then there's sundowning, and this is a specific kind of challenging expression that's pretty common, but it's as the day goes on, they get more tired. Typically, they get more tired, so they become more restless and have more confusion. So later on in the day, you might see some more agitation or confusion. Those are common things. Another thing that can cause challenging expressions is pain and discomfort. And I've talked about this a little bit. People with dementia may not be able to raise their hand and say, hey, you know what? I've had constipation for the last couple of days and I'm really in discomfort and pain here. But what they are able to tell you, or how they are able to tell you, is maybe patting that area of their body. They're not eating. Maybe they're not getting out of bed. Maybe they overreact when you try to help them. So they might scream or cry out. So they're telling you something. And on this slide, it gives you some examples of signs to look for if somebody's communicating pain or discomfort, because we can go in and help alleviate that pain. So in the early stages, and we'll walk through early, middle, and late, just some things to look for and what we commonly see as challenges potentially for that in those stages. Again, it's a very individualistic disease, but these are commonalities that we see. You might have somebody in the early stages that is have some anosognosia, which is they're really not recognizing the changes that are happening in them. So it's called a lack of insight, or they have a denial of their deficits. So they don't see the changes. They don't see whether it's that they're having memory loss issues or that they're not able to get through the day like they used to. So that lack of that perception or that insight of their own changes can be a challenge to our care partners, right? As they're trying to help and intervene and put stuff in place. Because as you can imagine, if I don't see any changes or problems with me, I'm going to be pretty resistant to your help. Excuse me. Now, it's not a static thing and it can kind of come and go. And some people might even have not be aware of some deficits, but of others, okay? So you can see that as well. But that might be a challenge that comes up in the early stages. Decision-making in the early stages or complaints about their memory. People in the early stages can still do most things, and we want to keep things as normal as possible. That really is the key to promoting dignity, enhancing quality of life and independence. But know that, well, their decision-making capacity might change a little bit. It's not that they can't make their own decisions. We just need to limit those choices for them. You might see that repetition in the early stages, whether it's they're asking you the same question, they're telling you the same story, et cetera, et cetera. This is where we need to come in and really manage our patients and our self-care as that care partner, because that part of their brain that has that short-term memory or even that working memory is very severely damaged, or it might not be there anymore. So physically, they are not able to record or hold on to new information. So they really physically don't know that they just asked you that question, or they've already told you that story for the 100th time. So we have to take care of ourselves and either answer the question like it's not been asked. Maybe you can easily redirect them and write it down. There's several things you can put into place, but a lot of it is self-care. Tag team out with somebody as well for that. And then you might see a lack of initiative that they start to with either withdraw inward, or they're not doing their hobbies or staying connected to their community like they used to. And that can be for a variety of reasons. Either they don't know how to do it anymore, they're afraid, they don't want to embarrass themselves because they might know something's wrong. But it's really just helping them stay connected in a way that is safe and comfortable for them. So denial, there's that anosognosia, so they have not a lack of insight into their deficits, but there's also grief, right? As they start to lose things, I can imagine that they go through the grief process, just like you and I will go through the grief process as we start to lose our loved ones. And they can do that by hiding it, covering up their deficits, making a joke about it, being agitated, blaming others, you know. They are losing independence and self. So that can be frustrating, I can imagine. There can be increased agitation, resistance to care because I want to hold on. I want things to go back to the way they were. They might fight for it. They might be rebellious because I want to be able to do like I've always been able to do. And they're just coping through the changes the best way they can. And then you might see depression. Depression you can see throughout all stages of the disease, but in the early stages, it can show up as withdrawal, higher anxiety, wanting things to stay the same. And of course, there are treatments, a variety of treatments for depression in all stages of the disease. So we do want to manage these behaviors. These are just some general tips, but keep things normal, like I mentioned. Maintain structure. So it's in maintaining that routine. If you already don't have a routine, get on a routine and stay there, because a routine, everybody does better on a routine, quite honestly. And so this is the day looks familiar every day. And if we stay on a routine in the early stages, it really can help in the middle stages as the person's progressing in their disease. And that routine helps provide familiarity. It provides comfort. There's some safety and security tied to it. And it can also help mitigate some challenging expressions. We really want to look at the environment. How do we need to set up the environment now, whether we need to change it now to make it simple and promote success, but also looking towards the future, knowing that this is a progressive illness and that my loved one will decline. Are there changes I need to make now that will help them be successful later on in the disease state? And that might be widening doorways, putting in guardrails, things like that, moving everything from upstairs to downstairs, etc. And then we really do want to watch how we are responding to them. I think this is a big key. We have to start working on how we change our communication, but how we're taking care of ourselves so we can appropriately respond when we do see a challenging expression, or we do see them do things that are just odd or that don't look like my loved one. And that's hard. And how do I cope with that outside of them seeing? And then, of course, treating depression in any stage of the disease if we think it's present. So in the middle stages of the disease, this is where we do start to see more challenging expressions pop up because they are becoming more confused. They are regressing more into their disease state, and they're regressing more in time. So they might be, it looks like they're kind of going back in time for some people. So their memories that they have might be in the past, not the future or the present. So they're living back in a previous time, but also their abilities are changing too. So their abilities, they can still care for themselves, but it's just going to look a little bit different. They're going to need a lot more support in the middle stages. So it's keeping things normal, but no, we're going to have to add a lot more support. And this is, do I need to have a more supportive environment? Do I need to step in and add more support, whether I'm helping them with their self-care activities, I'm managing their finances, I'm making sure they're getting their medications every day, because I may not be able to rely on them to do that You're probably not going to be able to rely on them to do that well anymore. And we want to make sure that they're all that stuff's being taken care of. And their language, how they're communicating, is still going to, using their words and sentences is still going to continue to progressively get worse. So that's why we see those expressions pop up, because they're still communicating. It's just that's how they're communicating, is how they're changing. Sometimes, especially in the middle stages, we know that our loved ones have the right to say no. They have the right to say, no, I'm not doing the shower right now. No to anything, really. We don't have this right to stop trying. So the best way to respond to when somebody's resistant to care, or they're saying no, or they're not cooperative, is to let it go for a moment, step back, give it 10 to 30 minutes. You go regroup, take a few deep breaths, do some self-care, stress management techniques, and then you come back. Because how we respond to their responses can make or break the interaction. So in the moderate stages, some things to add on to, just your general tips, is breaking down instructions or activities into really small steps. And really it's giving them one thought at a time. And let them do that one thought or that one step in that activity, and then we move on to the next, and then to the next, and then to the next. We always want to provide probably consistent verbal and visual reminders. So we're verbally reminding them, but we're also showing them. An example is with the going to the restroom. So it might be a verbal reminder of, oh, look, it's time to go to the restroom. But now I might need to walk them by the restroom so they see the toilet, or I might need to walk them into that, because they can still maybe use the restroom on their own. They just need a reminder of when and possibly how to get started. And during this time, this is a great time to really start looking into community resources, whether it is having somebody come in your home, looking at maybe some respite opportunities, day program opportunities. What is your area agency on aging? What resources do they have to offer? There really are a lot of community resources to take advantage of, and it's reaching out to generally your area agency on aging or the Alzheimer's Association. Of course, the James L. West Center here if you're in Tarrant County or Fort Worth, North Texas area, and we can get you connected to the resources we have. There's other educational opportunities, support groups, etc. So in the late stages, this is where a person's, they're physically needing a lot more help. So they're continued to decline in their dementia, but knowing that their eating habits are going to change, their sleeping habits will change. If they have any language left, it may not make sense, or they just have one or two words a day. They're going to have much higher difficulty following instructions. It's not that they still can't, we just have to be it's very simple instructions, and it's one at a time. And a lot of the times we might need to physically assist them with those. But during this time, we know that they might be withdrawing into themselves. Okay, so their world becomes so much smaller, but that doesn't mean that they're not there. We've got to reach them and connect with them a lot through the sensory stimulation. So touch, using music, smells, etc., to be able to reach and connect with them. But also know that when we have connections with them, or we want to do an activity or something, it's going to be a shorter period of time because they're going to need more rest. As their brain is changing considerably, they're going to need a lot more rest. And then physically, they're going to be completely dependent on care through all of their self-care needs at this point. And they may not be mobile at this point either. You know, just remembering, going back to that picture of the brain, that the brain is failing them, but it's not all gone. So we have to look at what's still remaining and how can we connect and work with them. So just some general tips for the late stages. Really at this time, we want to pay attention highly to our person's nonverbal communication. What are they trying to tell us through their nonverbal? And it might be through an expression, but it might be their facial expressions or their body language. And really looking behind what is the emotion behind what they're trying to tell us. And that is one of the keys to managing behavioral expressions, is looking at the emotion behind what they're trying to tell us. And I'm going to get to that in a second, but very quickly, I want to talk about this ABCs of expressions. And this is it's a tool for you to use to help you identify any possible triggers as to why somebody's doing what they're doing or not doing what they should be doing, right? And so it's called the ABC. So it stands for the antecedent, or you can say it's the activating event, the behavior, and the consequence. And really, this model helps us identify triggers. And if I can identify a trigger, then I can avoid it in the future. So this is really a great tool for help us to decode when we have some challenging expressions. And how we use it is looking at that antecedent. So if somebody has a challenging expression, and I'll use the example of one of our residents started using the restroom, a male resident, in the flower pots and like corners of the house and like closets, not the toilet, okay, but flower pots and in kind of dark corners of the house. So we had to go around. This was a new expression for him, right? And this is expression where we needed to intervene on. We can't have that. So we needed to see how can we prevent this from happening or really lessen the frequency of this happening. So we go to use this model with antecedent and we ask ourselves these questions. Well, what's happening? Okay, so he's using the restroom in these pots and in dark corners. Was there anything that happened right before this upsetting expression? So that with this, it can be right before that upsetting expression, or it can be several hours or even several days before. Something happened. Is there something different in the routine? Something that has changed, okay? And really thinking back on it. Sometimes it might be more obvious than others. Is there a certain place that this happens? Is there a certain time, in the environment? Is there a certain room, etc.? When does it happen? Is it a certain time of the day? Is there anybody involved? Is there always somebody there involved when it happens? And is there something that makes it worse? As we try to intervene, have we learned what makes it worse? Or is there something that makes it better that kind of helps a little bit? And then asking ourselves, well, why is this happening? And we come to this checklist of questions. And there's really 6 areas to start asking ourselves and to help us figure out why, okay? Who are they as a person? And this is, what are their preferences, their pet peeves, life patterns? This is very important for those of us that are working with somebody with dementia. We have to know our resident or our client, because that's really going to inform maybe their present challenging expressions. Or we as that family member have to think back, okay, what were they doing 20 years ago or 30 years ago? Are there any life patterns or things that I need to take into account as to maybe why they're doing X, Y, or Z? We want to try and see it from their perspective. Really, who are they as a person? And then we want to ask the level of dementia. We don't always want to jump to the conclusion, well, they've turned a corner. Now, that might be the answer. For some people, they've turned a corner, and so their abilities have changed, okay? But we do want to ask, is their confusion level changed? Is their understanding? Or have they lost their, or out of impulses? What about their memory? What's their sensory awareness? So really just understanding where they are in the stage of dementia and what typically are the symptoms of those stages of dementia. What can we expect? And then we want to ask, how are they feeling? Can we relate this back to a physical underlying problem? Particularly if this expression happens all of a sudden, or it's a change in their confusion level or their functioning ability. A lot of the times there's a physical underlying problem, whether it's constipation or it might be a UTI, or they're having problems with their senses. So the noise might be too loud now, or the lighting might be too harsh, or whatever it may be. It can also be emotional and physical, or psychosocial. So then we have to ask, well, are they sleeping well? Do they have a change in their medications? Is the weather bothering? Do they have allergies? All of those things, because that can cause a change in their expressions. And then we want to ask, what are we communicating? Excuse me. Are they just mimicking what they're seeing? So as a care partner, am I, or those around them, communicating frustration, anxiety, exhaustion? So we have to really think about what's our approach and really watching our nonverbal communication, because persons with dementia are going to pick up on the nonverbal visual kind of visual cue communication before they process any possible words. And then we look at the environment. What is the environment? How is the environment influencing them and how they're able to function? Are the lights too harsh? Is the noise too loud? Are there too many people around? What's going on? You know, in our community, we ask a lot, well, does somebody having a behavioral expression like the gentleman I'm using as the example, using the restroom and the flower pots, one of the questions is, you know, that's the change. Where does it happen? And it really kind of happens all throughout the house. But when does it happen? And it always tends to happen during our shift change, which is in the evening time. So it always tends to happen during the day. He's okay, but around shift time change, that's when he starts to find other places to use the restroom. Okay. So during our shift change, there's a lot more going on. We got old people, old shift leaving, new shift coming on. It's also generally kind of right after dinner time. So that might be, you know, more families might be here as well, visiting, helping with meals. They're cleaning up from dinner, etc. So there's a lot more going on in the environment. And then we ask ourselves about times, patterns, and routines. Has the routine changed any? Did they just move into a new environment? Have we changed or upset any of their old rituals or habits? And we got to think about, what are our old rituals? A ritual I know that my grandfather always had was that he checked the locks in all the house, throughout the house, at least twice before he went to bed. And that was a ritual he did every single night. At least twice he went around, secured that house at least twice, but making sure all the locks. And those were rituals he did his entire life. So he's going to continue to do that. We need to allow to continue those rituals, just as an example. So as we're looking at these, and I go back one to my example with my gentleman, you know, we ask ourselves this question: what's happening? Was there anything that was upsetting or just happened right before that? And we really couldn't think of anything that's changed in his routine. It happens really all throughout the house. There's not one particular room that he goes to. You know, who was involved, when does it happen? It's the time of the day that we have our shift change. So there's a lot of people involved because there's a lot of movement going on, right? And then we went through this whole checklist. All right, we went through his past, you know, who he is as a person. We did know that as a child, he grew up on like ranching and farming. So during the day, they would be out in the fields all day long. And when you're out in the fields, you don't stop to come into the house to take a restroom break because you're too far out, right? So you just kind of go wherever you can go. So we thought, well, that might play into it as well, as he's regressed in his life and memories. And then, of course, the environment. We came to the conclusion that it was overstimulation at that time for him, and he was just kind of looking for a place to go to relieve some anxiety. So we really put into place before shift change and right after dinner that we would make sure that he had used the restroom or that we got him to the restroom. And then we had him occupied with another activity during shift change. That was a low sensory activity. Sometimes it was listening to his own music with headphones on. Sometimes it was reading with another, a life enrichment aid over in a quiet area of the house. You know, things like that. And that really seemed to help and alleviate that challenging expression for him. But we did have to walk through this whole model to figure out the what, the who, the why, and then what we were going to do to help mitigate it. So I hope you find that really quick overview helpful for this. And I'll give you a better copy of the checklist things to ask. This is an example. Because of time, I'm going to skip through it, but you have to read that on your own. So some quick things I want to highlight before I do my poll, as we're quickly running out of time. But just best practices in managing and possibly preventing challenging expressions. Let's try not to say the word remember to our people that we love and care for and work with. But really, we want to validate their reality and their emotions. Excuse me. And I will put into chat the copy of the slides again. I see somebody's asking for them. the best thing that we can do is really accept our loved one's reality. Okay. So a lot of the times when somebody's having an upsetting behavior, or you might be accused of something, or whatever it is, I said behavior, I mean expressions, excuse me. We want to validate what's happening to them and what they're feeling, and the emotions they have are very real to them. And for us to invalidate them or tell them that they're wrong or say no, or remind them that they have, dementia and they're, not capable, that really can make it so much worse. And that's not the type of feeling I think we want to give to those that we love or we work with. So we really want to validate and actively listen to what they have to say. So when somebody is having an expression, we just say, okay, right? And okay is acknowledging that I heard you and I see you. And every human being wants to feel seen and heard. And using the word okay, we're not agreeing with them that, what if we're being accused of something? An example is maybe they're accusing you of stealing all their money. I don't want to say, okay, yeah, I'm not agreeing with that. But I'm like, okay, I hear you, I see you. And then I want to go and validate and fix the issue. So we validate their emotions and their feelings. And then we fix it with the therapeutic story as appropriate and as needed. So we have to put ourselves in their shoes and go to their world because they can't come to ours. So if you are being accused of stealing all their money, you think, okay, oh, wow, that is so frustrating. I can imagine. Let me tell you, let's call the bank and I'm going to get my name taken off that account. And then we go and we call the bank, and it's you either call your cell phone or you call a friend or you call somebody that knows what's going on. And you just say, I need my name taken off their bank accounts, period. Let's do this right now. Great. Whew, I'm glad that's taken care of. You know what? I'm a little bit hungry. Let's go get something to eat. So that we validate their emotions, we fix it, and then we distract. Mm-hmm. Another example is that they're looking for somebody that's passed away. This is fairly common. And to tell them that their loved one's either passed away or they're no longer with us is really invalidating. And that can be very upsetting. It's like they're hearing it for the first time, that the person they loved is dead. And we don't want to do that, right? So we say, oh gosh, okay, you know what? I heard, if they're looking for their dad, for example, dad called earlier and I'm so sorry I forgot to tell you, but he's going to run late because he's going to go play golf after work. Oh, he just loves his golf, doesn't he? Tell you what, let's go ahead and get dinner started. I could really use your help. And then we move on to a new environment. Mm-hmm. I didn't tell him, your dad's been, passed away for several years now and you were living in, the memory care unit. I didn't say that. I met them where they were at because, again, their reality is very real to them. I know their past, know a little bit about their history. Their family loves to golf, right? Dad's going to go golf today. He loves that golf. I tell you what, let's make sure and have dinner ready for him. Let's go get it started. And then I move them to a different environment, or I distract them with something else. And that's the best thing to do. Your best distractions are food. The sweeter, the better, always. Music is extremely powerful, and it's music from their past, music that they enjoy. And it might be from way in their past when they were kids. So let's think about that. And we can have it as a distraction because we can sing and dance along with them, or it can just be something that we have on in the background. Mm-hmm. And then, of course, these aren't kids, these are pets. I guess they're furry kids, right? Pets or kids. Mm-hmm. And that can be either pulling up pictures. YouTube is great to pull up pictures, little babies laughing, always gets everybody smiling, little animals, baby animals running around is a really great distraction. But I validated their emotion and their reality and those feelings that they had. I fixed it the best I could, and then we moved on to something else. I think another thing we want to start putting into place is really having those purposeful activities, which I mentioned a couple of times. Because if somebody doesn't have purposeful or meaningful activities throughout their day, that really can invoke a lot of feelings of, worthlessness, boredom, loneliness. But if they have activities that are set up for them to do. So they're set up in a way that they can be successful, but they're giving back because these, our loved ones have always been a part of community and they've always contributed. And that's a basic human need to give love and to give resources and give back, but also to receive, right? But how many opportunities do they have to give back? So let's set up these activities, purposeful activities, and it can be hobbies that they've always enjoyed doing. Let's just make sure and incorporate those back as we can and as appropriate, but really focusing on these activities that provide meaning, that provide dignity and give independence. Mm-hmm. And if we have these set up and it's a part of just kind of our structured environment and our routine, it really can prevent challenging expressions. And then really watching how we approach them, but how we approach those activities as well. So it's choosing or tailoring activities that meet their abilities. And sometimes it might be that we have to get them started on the activity, but also know that doing an activity is not about getting something done. It's about the experience. Okay, so because of the time, I will attempt to do this poll. I'm going to pull this up really quick. And if you will just select one of the listed expressions that you would like to talk about, and then I will talk about as many as we can get to in the last few minutes that we have together. So if you will please put your answers in there, and I'll just start the one that had the highest percentage. And you will get a copy of these slides. If you don't already have it from the chat, I will send it in our follow-up email. Okay. So it is in, let's see. All right, so I'm going to start with sleep disturbances and sundowning. And then move to hallucinations, delusions, and paranoia. And then rummaging, hoarding, if we have time to get to it. If I have time to get to this. Thank y'all so much for participating in that. Okay, so I'm going to skip ahead to where I know we have these things. So sleep disturbances and sundowning. Part of the brain changes that happen in persons with dementia is that their circadian rhythm is going to change. You saw the picture earlier, and we saw the brain shrinking. There's more the lay terms, but there's more holes within the brain. So with those structural changes that are happening, there's also chemical changes that are happening. And that really does contribute to sleep disturbances. So those chemical circadian rhythm changes will happen. It's also they're having a harder time understanding the environment, and that's the outside environment as far as the sun and the moon go. So they can very easily get their days and nights confused, and it's pretty common. If they have a Lewy body dementia, they're more prone to this, but they can have very vivid dreams, or they act out their dreams, or they might even have a sleep-related disorder. So whether it might be restless leg syndrome, or they might have a REM sleep disorder, and you can get tested for these, or you can just start to implement some of these changes. But know that this is common, okay? But what we want to do is really start setting up, and this can be part of a routine, to start setting up a good sleep hygiene, because you can reset the circadian rhythm. Now, it's not going to be perfect, and it's not going to happen overnight. It's going to take probably 30-ish days, if not longer than that, for them to get back more into a more regular sleep cycle. But we're going to get up around the same time, and we're going to go to bed around the same time. Okay, and we want to be consistent about that, right? When you get up in the morning, you want to go ahead and get some sunlight. So this is sunlight on the skin, and this is either we go outside and we get sunlight on there, because this is where the environment will help the brain work properly, because when the sunlight hits that skin when we wake up, that's kind of starts that circadian clock, or that sleep cycle. It starts it. And that way, after so many hours in the day, it will start to end that sleep cycle, so they go to sleep. But that sunlight is so helpful. So it's getting sunlight, it's just sitting by the window with the curtains open, or you can get a happy light or a light therapy box. You can get those on Amazon, and they simulate sunlight. And if you sit in front of that for 30 minutes, maybe you have it on during breakfast or something, that can help the brain kind of reset itself. But we're doing this consistently every day. We want to incorporate physical activity early on in the day. And this might be walking, it can be chair stretches, it can be just mobility, range of motions exercises, or it can be going to the gym, depending on your person. Okay. We want to really watch the diet and see what we're happening. Avoid alcohol, yes. Avoid caffeine altogether. If not, just stop it really early in the day. Okay. And then at evening time, we want to make the evening time a relaxing, restful time. So this is, what are we watching on TV? Do we love those crime shows that might keep us up and excited and dreaming about them throughout the night? Can we watch those earlier in the day and then maybe watch something that promotes sleep, maybe a documentary at nighttime? Okay. Also looking at the restroom and toileting schedules. If they're getting up to go to the restroom in the middle of the night, and you might not be able to avoid that, but are they going back to bed? Can we set it up to where they go back to bed? So not having all the lights on in the house. If they are up at night and they're ready to get up and go, just show them or remind them, hey, it's still dark outside. There's a few hours of sleep. And we might just have to show them. So it might be opening the curtain to show them, hey, it's still dark outside. So they see that. Let's go back to sleep for a little bit longer. Making sure their bed's comfortable, that the temperature's down a little bit so the body can regulate itself, the body temperature can regulate itself. And then you want to talk to your doctor or the pharmacist about melatonin. And this is you can get it over the counter, but please talk to your doctor and the pharmacist before you start incorporating it because melatonin can help promote sleep. It's a hormone that our body stops producing as well as we get older. So this can help promote sleep and stay asleep longer. With sleep disturbances, it might be that while your loved one is readjusting back to a regular sleep schedule, that you as the care partner need to stay on a regular sleep schedule. So it might be that you use cameras or you have a monitor that you can hear them getting up. As long as they're safe, that's okay. Or if you just need to go redirect them and go back to bed, then that's okay. But if they're getting up and doing something and they're safe and they're okay, then it might be the best decision for you to stay in bed and get your rest so you can manage it better during the day. And then sundowning. I mentioned this earlier, but it's a time of the day that people become more confused and more restless. Typically, it's late afternoon, early evening when the sun goes down, where that term comes from. But it can be any time of the day, depending on the person. But this can be a lot of times just caused by somebody being tired and unable to cope with that tiredness or that restlessness. It could also be that they were bored to tears throughout the day and now it's evening time and they have all this pent up energy. And so they become more restless, but there's more confusion too. Okay. So there might be more restlessness or agitation because they have some pent up energy. I would say if somebody is experiencing sundowning syndromes, one of the best things you can do in the moment is do something physical, whether it's throwing the ball, whether it's hitting a beach ball with a pool noodle, is doing something physical to get that energy out. At our day program, we have axe throwing that we do. It's all safe. It's all plastic stuff. But that really gets some of that pent up energy and some of that restlessness out. But also it's setting up that time for rest and relaxation. So what is the environment saying? What's on TV? What are we experiencing or what are we communicating? Because we might have been exhausted from the day and we're communicating exhaustion and impatience. So we might need to take a time out as well. Well, it is 12:30 and I want to appreciate y'all for staying with me. I'm sorry that we didn't get to more of those specific common behavioral expressions. But again, you have a copy of the PowerPoint and it goes into, there's a lot of information on each one of those slides and it goes into more in depth about each one of those. If you have questions about any of that, please feel free to email me. My email address and phone number is on the slides as well. You should have my email address anyway, I hope. But I know that it's 12:30, it's the end of the session, but I will stay on a few minutes longer if anybody has any questions and wants to stay on a little bit longer. I appreciate your patience with me and working through all that information. But any questions anybody has?
Hello.
Hello.
Hi, thank you so very much. It's just so informative. I have had to deal with this quite a number of times and it's running rapid in the history of my family. And so I'm just eager to continuously learn about it. One of the things I wanted to ask you right now, if possible, I'm participating in a community health fair. And I know old school, we had pamphlets and brochures that people could pick up. I'm having a hard time gathering anything on dementia or Alzheimer's. Is it possible that, you guys might have some that you could share with me for this community health fair? Because, I'm really, so many people, this is a church fair, and so many people there, family members are having dementia, Alzheimer's.
Yes, yeah, we can share with you. We have some rec cards that talk about the difference between dementia and Alzheimer's and ways to reduce your risk, or if you want a copy of some specific slides, we are happy to provide those, Daisy. If you just want to email me separately, and then we can set up a time to get you what you need.
Okay, thank you so very much. And again, I really appreciate the presentation.
Good. Thank
Great
you.
job. Thank
Thank
you.
you. And I will send an email this afternoon with a copy of the slides and the evaluation, and if you wanted CE credits as well. And our upcoming programs.
Thank you again.
Thank you. If there aren't any other questions, I appreciate your time and your listening. Yes, I will. So the recording, thank you, Sandra. The recording will be uploaded to our YouTube channel within the next couple of days. And I will send a link to our YouTube channel as well. So thank you. Thanks for that reminder. All right. Well, I appreciate y'all. Thank you so much. And we hope to see you on a future program. Or feel free to reach out to us in between programs. Bye-bye.